This video is a mini guide to nutrition and exercise for women who are pregnant or looking to become pregnant. When athletes become pregnant, some may choose to continue on with training for most of their pregnancy, while others may choose to take a break, but it is important to stay active during pregnancy. Some fear exercise will harm the baby, but the only time to stay sedentary is when directed by a doctor. This could be due to conditions such as gestational diabetes and preeclampsia. Going outside of a doctor's recommendations could have effects on the baby, leading to heart disease, hypertension, neural tube defects, and low IQ. Certain symptoms can occur during excessive exercise, such as vaginal bleeding, dizziness, headache, chest pain, and calf pain. If this occurs, stop and talk to your doctor. If athletes continue to train at their previous level, they need to make lifestyle changes like reducing physical activity and increasing caloric intake of macro and micronutrients to meet the demands of exercise and a growing baby.
So in general, pregnant athletes should increase their caloric intake by about 300 calories per day, although there is a range that goes anywhere between 25 to 800 calories, depending on the level of activity in which the athlete engages. Now, one of the best indicators of proper caloric intake is simply normal weight gain during pregnancy. So it's important to always follow up with your doctor, and if your doctor says that you are increasing your weight normally, then that's usually a good indicator. So during the first half of pregnancy, the protein intake remains roughly the same as for non-pregnant women. So that's usually about 46 grams of protein per day on average, or about 0.8 grams of protein per kilogram of body weight. Now, during the second half of the pregnancy, the protein requirements go up by 20 to 25 grams per day. And of course, this is on top of what the person was already consuming. So, for instance, a sedentary woman, her protein intake would go up to about 71 grams of protein per day. But for athletes, they would just increase their protein intake by about 20 to 25 grams on top of what they were already consuming. The carbohydrate and fat intake remains proportionately about the same. So during pregnancy, carbohydrates are still the main source of fuel for mom and for the baby. So it is important that, that mom consume anywhere between 50 to 65% of her total daily calories from carbohydrates. Fat is also a very important source of concentrated calories during pregnancy, and also this fat is going to help mom absorb the fat-soluble vitamins that she is consuming. There are several vitamins that are more important during pregnancy, and we're going to talk very briefly about those. So one of those is vitamin B, and vitamin B is very crucial for the production of energy and tissue development throughout mom's and the fetus's body. But of the B vitamins, the one that's most important is folate or folic acid. And so folic acid has been shown to dramatically reduce the likelihood of neural tube defects in the developing baby. So it's very important for mom to consume folic acid during her pregnancy and even before she's considering becoming pregnant, in order to assure that she has enough folic acid stores in her body. So the folic acid recommendation goes from 400 micrograms per day to 600 micrograms per day during pregnancy. Then vitamin C requirements also increase slightly during pregnancy. So they go from about 75 milligrams a day to anywhere between 80 to 85 milligrams per day during pregnancy. Vitamin A also increases slightly during pregnancy. So the need for vitamin A goes from about 700 micrograms per day to about 750 to about 770 micrograms per day during pregnancy. Then also magnesium is important, and magnesium is important to athletes in general because of their role in, in energy production and ATP production. So for that reason, it's very important, even for the non-pregnant woman. But during pregnancy, the requirement for magnesium goes up by about 40 milligrams per day, from about 310 milligrams per day. So a total of about 350 milligrams per day of magnesium is what's recommended. And then iron. Iron is very important for women in general. So generally, the recommended amount of iron consumption is about 18 milligrams per day in the non-pregnant woman. But during pregnancy, that need goes up to about 27 grams per day.
A good way to improve caloric intake is by increasing the portion sizes slightly or by adding 1 or 2 snacks per day. Some good options include fruit, milk, nuts, vegetables, and cheese. It is important to consume 80 ounces of water per day plus 18 to 20 ounces for every hour of exercise. Hydration is important for the development of the amniotic fluid for the baby.
So now we'll talk about pregnancy and exercise. One of the biggest reasons why women do not exercise while pregnant is because of the fear that they will hurt the baby. This fear is outweighed by the many benefits that exercise has while pregnant. It can reduce backaches, constipation, bloating, and swelling. It can boost your mood, energy levels, and immune system, help sleep better, prevent excess weight gain, promote muscle tone, strengthen endurance, and make delivery easier and labor shorter. But if any negative symptoms occur during exercise, stop. Stay in tune with your body and do not push yourself too far. You may have to adjust your exercise due to changes in the body, such as joints relaxing due to certain hormones that can increase the risk of injury, your center of gravity being shifted with more weight in the belly, throwing off balance. Breathing can be more tasking as additional pressure on the diaphragm can make it harder to breathe, especially during high-intensity exercise. Pregnant women should exercise at a moderate intensity for 30 minutes for most days of the week. Some examples of exercise are brisk walking, swimming, stationary biking, modified yoga and Pilates, keeping in mind to exercise to an intensity that allows you to be able to talk normally during, but not be able to sing. If you want to continue the exercise you had before, just check in with your doctor for approval. There are certain exercises to avoid, such as those that force you to lie on your back during the first trimester, contact sports, activities that pose a high risk of falling, exercise at high altitudes, and hot yoga or hot Pilates. So 3 ways to stay on task are to find a buddy, take a class, and to start small.
When diet is recommended during pregnancy, it does not mean restricting what you eat and lose weight. Instead, increase caloric intake but in a healthy and safe way. Although all these recommendations have been obtained from credible sources to give a brief overview about pregnant athletes, it is important to check with your physician. Some famous athletes like golfer Catriona Matthew, beach volleyball player Kerry Wolf Jennings, and Serena Williams have continued to train and win competitions while pregnant, so it's gotta be easy.